touched a little bit on the OT eval, which is something that I wanted to ask. Like when we go through our list of questions, a lot of times we don't typically ask about body image or sexual health. And I think it's because people aren't sure if that's something that you should bring up to a patient or if that's something that they should bring up to you. And I don't know what your thoughts or what you've read on that. So I wanted to ask what
I
you
think that's
think.
a great question. I think that it depends a little bit on where you meet them. If you meet them in a pelvic floor clinic, I think asking about sexual
Yeah,
function has to be part of what you
yeah,
do, right?
yeah.
But if you meet them, maybe about they're coming in with you because they were referred because they have some cording or they have, limitation at the shoulder, maybe they will be like a little taken aback if you ask them about intimacy or sexual health. So my advice would be to tailor the symptom assessment to the role
Mm-hmm.
and the referral reason, but to give everybody an opportunity to tell their cancer story. And even if it takes a few minutes off the time to say, how has some a sort of a general open-ended question like, how has your cancer diagnosis affected the way you feel about your body? That's a
Mm-hmm.
perfectly fine question to ask. And you'll be cued by the answer. Somebody will say, "Oh, I'm here because I'm tense here." Or somebody may actually say, don't I don't like the way I look. I haven't been able to
Mm-hmm.
look at myself. I haven't been able to let my partner look at me or whatever. And then you might say something like, have you shared this with anybody? How do you think I can help you with this? And even if it's not something that you can have a treatment for, you can at least say, I recommend that you speak about this with your oncologist or your primary care doctor. There are people who may be able to help you with that as well. So that's the way I would counsel anybody that, when you enter into a therapeutic relationship with a cancer survivor, specifically to address a symptom, to say, how has this affected you? Are there concerns that you want to share with me? Is it okay if I
Yeah.
give you some advice?